Welcome, FamilyAffaires.com contributor Dr. Dan Gottlieb. Hi.
Hey, it's good to be back.
It's great to be here. Dr. Dan, as you know, recently, it was just last week that Robin Williams committed suicide. And initially when the reports came out, they were focusing that he had depression. And then later on, his wife came out and made a statement that he was suffering with the early onset of Parkinson's disease. But really what I'd like for you to focus on, because I know that you've had experience with it, is male depression. I don't think that we talk about it enough as a society. And in a lot of the literature that came out, they were saying that recently, I think it's been over the past 11 years, there's been like a 40% rise in suicide in men. So I'd like to hear your opinion on it and talk about male depression, because I'm sure there are different signs than female depression. So let's educate our listeners.
Yeah, male depression does not get talked about enough, and men experience depression differently than women do. As many of your listeners know, I've had my own experience with depression. And the first episode of major depression, maybe the second, I was even unaware that I was experiencing depression, because I wasn't feeling that classic depressed mood that I was aware of. But I was driving with my nurse, and she looked over at me and she said, "Dan, you look like you have the weight of the world on your shoulders." And in that moment, I knew, my God, what's going on must be depression. I felt withdrawn, I felt insecure, I felt filled with shame about feeling different. I was afraid to speak my voice because I didn't trust my voice, and I didn't find any joy in my life. And not feeling joy in my life was not outside of the pale. When you talk to a lot of men, joy, it's not on the radar for us. It's doing what you have to do in life. So I didn't know I was depressed, and a lot of men don't know they're depressed.
Do you think there's also a stigma attached to men having depression? Men are usually seen as the strong ones, the ones who take care of their families, and like you said, it becomes kind of a shameful thing. That even if men sense that something is different, they don't necessarily go to and think about, oh my God, I'm depressed.
It's important to know that depression, among other things, is a brain disorder. It's about hormone imbalances in the brain. That's number one. And there's environmental factors. If you are feeling depressed, if you have symptoms of depression, there may well have been others in your family before you who were depressed. You may have had one or both of your parents who've had elements of depression, so that not only do you have the genetic risk, but you were raised by a parent who may have had genetic threads in there. There's other environmental factors. We can come back to Robin Williams, and we can look at not just depression, but his history of substance abuse and how he fell off the wagon after 20 years of sobriety, and Parkinson's. And none of these things are his fault.
No.
None of them are a sign of weakness. My God, to get clean and sober, that's enormous strength and
Takes courage
and faith to do that. So there's no weakness there. So it's important to know it's not your fault. And that's a quote from Robin Williams, actually.
Really?
In Good Will Hunting, he wrote on the blackboard, I'm just remembering this.
That's great.
First time. He wrote on the blackboard to Matt Damon, he wrote, "It's not your fault." And that changed everything
Wow.
in the movie. So if you're feeling depressed or symptoms of depression, it's not your fault. There are lots of treatments available now. We don't have a cure, but there are lots of treatments.
So what would be the first step if somebody feels, and men especially, and you were talking about the signs. So you spoke about a couple of them, not feeling joy, having self-doubt. Anything else that would be a kind of a sign that jumps out at you?
Well, certainly a depressed mood, feeling insecure, feeling angry or irritable are often signs in men.
So what would be the first step to take if you think you might be depressed?
First step typically is to see a family doctor. Unfortunately, a family doctor's first line of defense or treatment is going to be medication. Now, medication works well in conjunction with psychotherapy for moderate to severe depression. For mild depression, medication's not the way to go.
So it would be psychotherapy?
It would be psychotherapy.
Okay.
And, you know, psychotherapy really helps. It's not good psychotherapy for depression now is structured, it's smart, it's science-based, it's not sitting around all day and going over all the details of your history or talking about your dreams ad nauseum. It's very different than it was even a couple of decades ago.
Let me ask you, going to your family physician as opposed to going to a psychiatrist. I was always of the assumption that a psychiatrist is more specialized in those types of medications.
There's an expense involved, and there's practicality involved. I tell my patients who do have moderate to severe depression, you go to your family doc first.
Okay.
Take the medication they prescribe. If it doesn't work, if it's not effective, then you go see a psychiatrist.
Great information. Thanks so much, Dr. Gottlieb. I'm sure we're going to help many with this
Thank you. I
video.
sure hope so.